So ICG fluorescence imaging is able to see things that we are not able with our naked eye. So it's very important for us during the surgery to see very well, for example, the vascularization of the tissue after a colonic resection. And using this technique, it really gives us information that it's not, that we don't have, using standard technique without fluorescence imaging. So in your case, for example, you need to have a colonic resection, and one of major problem after a colonic surgery and colonic resection is anastomotic leakage. And so actually with the use of ICG fluorescence imaging, we can really see tissue that are very well vascularized or not. And so it really guides surgery. For us, it's very important to know exactly where we have to cut the colon before to perform the colonic anastomosis. And that's a real advance due to this technology. So for you, the benefits, the major benefits is to decrease the risk of complication after the operation. As I told you before, we know that after this type of surgery, we have a risk of anastomotic leakage. And using this technique, it has been shown that we decrease the rate of leakage to under 2%. So it's really a low rate. And so the advantage is to decrease the postoperative complication. So I use it for the colonic resection. I use it also for the sentinel lymph node detection. For the last one, we do it in a clinical trial because actually this indication is not yet recognized or FDA approved. So for us, the advantage is we are happy if we decrease the risk of postoperative complication. It's not only for the patient, but also for us. It's very important to have patient recovering well and being well after surgery, and that's the goal. That's for the use of ICG fluorescence imaging for the perfusion assessment. On the other hand, if we use it for the sentinel lymph node detection, I think it's very important because we have shown that it impacts on the therapeutic attitude afterwards. So using this technique for the sentinel lymph node detection will give us again more information than before, and this information can really impact on the therapeutic management. As for example, if we find metastasis on this lymph node, this patient will be treated differently using, for example, adjuvant chemotherapy. It's very easy. The one of the major reasons to convince him is just to let him show that during the operation we are able to see the things differently, to see more the vessels, to see the tissue perfusion, and so it's very important. He will directly see the advantage of the technique. I think in our country the major challenge is to recognize the ICG as a drug that can be used otherwise than by intravenous injection, as for example for peritumoral injection or for cholangiography to evaluate the bile duct. And so on. That's, for me, it's probably the most important thing in the future. It's to have the approval of the authorities to use it very freely outside of clinical trial.